Erica. I'm an NP student at UTEP, and today we're going to be doing a respiratory and cardiovascular assessment on Joanne here. Of course, always prior to assessing your patient, make sure that your hands are on. Initial assessment, we're going to inspect the chest. So we're looking at rate, we're looking at rhythm, we're looking at depth. We can see she's in no acute distress. She's breathing normally. There's no tachypnea. For starters, next we're going to look at the anterior and posterior chest. So we could ask the patient to take off their shirt. We're looking at, again, color. We're looking at if there's any lumps, any masses, any kind of issues with her breathing. On inspection, we see that there's no delay in movement, there's no masses, no deformities, and the chest is symmetrical. Next, we're going to palpate the chest, but we're going to go from the back to see if she does have that normal chest expansion. We're going to check again for masses, like actually visible masses, and go from there. Okay, so now I'm going to touch your back. Do you have any pain or tenderness when I touch you?
No.
Okay, anywhere here in the front?
No.
Okay.
No.
Now, what I'm going to do next is I'm just going to place my hands on your back, and I want you to inhale through your nose, exhale through your mouth. Just a nice big breath, and we're going to see if you have symmetrical chest expansion, okay? So go ahead and take a deep breath. Okay, perfect. So that was equal on both sides, equal chest expansion. Okay. So next we're going to measure fremitus. So I'm going to place this bone on the part of your chest, 6 different spots here, and then 8 on the back. Every time I place my hand on you, all you have to do is say 99, okay? So this will help us understand if there's any kind of underlying condition that you have, okay? So here's the first one, so go ahead and say 99.
99.
Okay, here.
99.
And then here.
99.
Okay, on this side.
99.
Okay, one more time. Sorry.
99.
Okay, here.
99.
All right, we're gonna go to the back, and it's gonna be 8 different spots on the back, okay?
Okay.
So every time I lift, we're gonna go ahead and do 99, okay? Go ahead.
99.
Here.
99.
Okay.
99.
Last one.
99.
All right, one more.
99.
Okay.
99.
Mm-hmm.
99.
Okay.
99.
Perfect. So you have the expected fremitus. It's not dull and it's not hyper-resonant. You don't hear more than we need to. So next we're going to percuss the chest. We're going to do this to see if the tissue is air-filled, consolidated, or filled with fluid. So I'm going to use my fingers to kind of tap on your chest with the opposite. We're going to do that 10 times on the front, 14 times on the back. You don't have to say anything, just need you to breathe normal for me, okay? And we're going to start here above the clavicle.
Okay.
That's where we start, okay? So again, that's it. Just stay on one side. And come down here. Okay. And again on the other side. All right, and then we're gonna go to the back. This is gonna be another 14, okay? So just relax for me, okay? Here's the first one. It's like a ladder pattern. Okay, so all your percussion sounds are resonant, so the normal. So next we're gonna listen to her lung sounds. We're gonna do this with a stethoscope using the bell of the stethoscope. We're gonna use the same pattern we did when we were percussing. Prior to listening though, I'll ask you to cough just to kind of remove any mild atelectasis that you may have, okay? And again, normally we would ask her to take her shirt off to listen, but for the sake of this video, we're gonna keep it on, okay? So go ahead and give me a cough. All right, I'm gonna go ahead and listen, okay? And we're doing multiple breaths, so listen per every breath, okay? So go ahead and just breathe for me, okay? Breathe in. Okay, I'm gonna come in there real quick. Okay, I'm gonna do the opposite side. Okay. Now on the bottom. Okay, so now I'm gonna move to the back, okay? Actually, do you mind just turning for me? Okay, we're going in that same ladder position, okay? So we'll start at the top and then we'll come down, okay? All right, go ahead and breathe for me. Okay, back to the top. Okay, all your breast sounds are equal, they're clear, you don't have any adventitious breast sounds. So next we're gonna start the cardiovascular assessment. Upon appearance, we see that the patient is pink in color, she's not blue, she's normal for her ethnicity. We're also gonna take the blood pressure as well. This will tell us what her heart rate is too. So we'll just let it go. Normally, if you're not using the automatic blood pressure cuff, we can also use a manual. So her blood pressure is 105/79, which is 100% normal. It's a great blood pressure, and her heart rate is 75. So totally normal. Normal heart rate is going to be anywhere from 60 to 100. Normal blood pressure systolic is going to be less than 120. Normal diastolic is less than. Okay, so next we're gonna estimate the level of JVP. So I'm gonna have you lay down supine for me. And then we put pillows down so that we can have a 30-degree angle. We're gonna use these tools to give us an estimate about what JVP is. So however, at what we wanna call it is about 30 degrees. And then we're going to measure the JVP, okay? So we'll come this way. Obviously this would be better with not a couch. So we'll come this way, measure, we're looking at the right IJ from here. And we'll estimate her JVP at about a 2, okay? Which is normal. You wanna be below. So next we're gonna listen to the carotid arteries. We're gonna do this with the bell of the stethoscope. Obviously one at a time, never both because that can cause syncope. So I'm gonna sit down next to you and we're just gonna relax, okay? Just take a quick listen. We'll start here. I'm gonna come up and listen here. And we do hear a throat. Okay, so next we're gonna palpate the carotid pulse, including the carotid upstroke as well, okay? So I'm just gonna have you, again, lay flat for me, okay? Okay, so we're gonna measure the amplitude, contour, and timing of the carotid arteries. We're gonna do that one at a time. We're gonna use fingers, okay? So I'm gonna touch your neck, okay? So you're gonna feel here, this way. Okay, and then we're gonna come up with the thumb. Feel okay? And we'll do it the other side. We'll come up. And you can see the pulsations of the carotid artery. We see that the carotid has a normal amplitude as well as contour and timing. Okay, so next we're gonna palpate the precordium. This is to see if she has any heaves or thrills or palpable heart sounds. So I'll ask you to lay down again for me. And we'll use the palm of my hand as well as my fingers to feel your chest to see if we can feel any of those, okay? So I'm gonna go ahead on the other side and just gonna put my hand on your chest, okay? So we're gonna feel here. Tell me if this is too much pressure. Okay. Then I'm gonna get under here to see if we can feel that apex. Okay, so there are no heaves, thrills, or any palpable heart sounds, okay? Okay, so next we're gonna feel for your apical pulse. Since I wasn't able to feel it prior, I'm gonna have you again lay down. This time though, I need you to lift up your left breast and then we'll exhale. And I just want you to hold your breath for a few seconds, okay? This should help us feel it. If not, we'll have you turn 40 degrees to the left to see if the apex of the heart hits the chest wall and get a better feeling for it, okay? All right, so again, it's just the palm of the hand. So exhale for me and hold your breath. Yeah, you can feel it. Okay, so yeah, there it is. Okay, so next we're gonna palpate for systolic impulse of the right ventricle as well as the pulmonary artery and aortic outflow tract areas, okay? So again, I'm gonna have you lay down for me. Keep the head of the bed 30 degrees and with 2 fingers, I'm gonna feel 2nd, 3rd, 4th, and 5th intercostal space, okay? So again, here I come. So here's the first one here. Mid-clavic. What is that? Clavicular? Mid-clavicular space, okay? So we have the first one, number 2, 2nd, 3, 4, and 5. And so yeah, we can feel the systolic impulse, pulmonary artery. Okay, so next we're gonna listen to her heart sounds. We're looking for S1 and S2. I'm just gonna place my stethoscope on 6 different parts of your chest and then we're gonna listen from there, okay? Just breathe normally for me and we should be good to go, okay? So here's the first one. Let me come down here, okay? And here. And then here on this side. Okay, so you do have S1. So when we listen to S1 and S2, we do want to look for the splitting of S2. That is basically when the patient takes a long, slow breath when we're listening, or at the apex of the heart. This allows us to listen to the splitting of the first beat, so S1, whenever you inhale. So when you have that deep breath at the base of the heart, this allows us to hear that splitting of the second, that S2 sound, okay? So next with the bell of the stethoscope, we're gonna listen for S3 and S4, which would indicate some kind of murmur or mitral stenosis. So again, we're gonna listen to the same spots, but with the bell of the heart, okay? I'm gonna take a seat next to you. We'll go again, okay? Here, hold on, gotta switch. Last one. Okay, so no S3, no S4, so there's no indication for any killers. So next, with certain patients, we have to distinguish between diastolic and systolic murmurs. We know that a diastolic murmur is going to occur between S2 and S1, whereas a systolic murmur is going to occur between S1 and S2. So we're going to go ahead and listen to see if you have either, despite the fact that we did listen for S3 and S4. So what you're gonna have to do is we're gonna sit here. I'm gonna sit with you, and I just want you to take in, so we'll practice, right? You'll take in a deep breath, right? And then we'll listen, you'll lean forward, and then blow it out, and then hold that breath, okay? And then we'll do that and listen to all our spots again, okay? So, and then we're gonna be doing this with a diaphragm, again, of the stethoscope. So go ahead and lean forward for me, just a smidge, and then we'll take a deep breath in, blow it out, and then we'll hold it, okay? Okay, go ahead and do it again. Breathe in, out, hold. Okay, again, breathe in, hold. Okay, breathe in, out, hold. Okay, breathe in, out, and hold. Okay, so there's no, for me, any systolic or diastolic murmur that I can hear. And that concludes our respiratory and cardiovascular assessment. My name is Erica. I'm an NP student at UTEP, and today we're going to be doing a respiratory and cardiovascular assessment on Joanne here. Of course, always prior to assessing your patient, make sure that your hands are washed.